Hello, PsyQ community, and welcome to today's webinar, Understanding Integration, Identifying Top Models, and Knowing the Future of its Roles in Health and Human Services. Thank you everyone for joining us today. My name is Anna Bassoff, and I'm a Managed Market Liaison for Otsuka Pharmaceutical Development and Commercialization. I will serve as the moderator for today's discussion, featuring Ms. Margaret Mays and Ms. Kathy Gilbert. This presentation is sponsored by Otsuka and Lundbeck, and these are our objectives for today. We will first be discussing the drive towards integration, and then we'll go through some of OpenMind's top 10 models of integration today. Finally, we will consider the challenge, the bridge, and the future of integration. The widespread fear, bereavement, isolation, and economic disruption caused by the COVID-19 pandemic exacerbated the world's strained mental health, putting additional pressures on the existing network of mental health resources. In order to better support mental health during this exceptionally difficult time in our nation's history, behavioral health providers were forced to quickly adapt many technologies that were being piloted before the pandemic, such as telehealth, digital health tools, wearables, and artificial intelligence. Detailed explanations of these issues affecting the health and human services industry are documented in Otsuka's Trends in Behavioral Health Guide, 3rd edition, the guide, which will be published free of charge on psyq.org. The goal with this guide is to continue to make a positive contribution to the national conversation among key stakeholders, including commercial and government payers, integrated delivery networks, and providers, about the disproportionate effects that behavioral health disorders place on Americans. While there has been much progress, there's still much work to be done to address mental health issues on a more systemic basis. This 3rd edition begins with an overview of the U.S. healthcare system, including federal policy updates, federal healthcare programs, the evolution of the Affordable Care Act, federal safety net systems, and a brief legislative outlook. The guide then moves on to look at the states, specifically Medicaid, behavioral health financing, and delivery models, Medicaid expansion among the states, population distribution by payer segments, Medicaid financing for people with serious mental illness, and behavioral health initiatives. The guide then pivots to a review results of a national payer survey of more than 1,100 individual health plans addressing current and future plans for behavioral health. The 3rd edition closes with analysis of consumer access to care and delivery, including telehealth, value-based care benefit plans, integrated care coordination, social determinants of health, and managing long-term support services. Throughout the guide, the authors examine how COVID-19 has changed the behavioral health care landscape, most notably the swift switch from in-person behavioral health to telehealth and the current and future impacts of serving a growing population. And now I would like to welcome our first speaker, Ms. Margaret Mays, who will be going over the drive towards integration.
Thank you very much, Anna. There are many different, if you look in the literature, there's many different definitions of integration and what integration is, but there's also some similarities between these definitions. Integrated health is unique in that there is a sharing of information across the team members that are related to the consumer's care. There's an establishment of a comprehensive treatment plan that addresses both the biological, psychological, and social needs of the consumer. And it's delivered by an interprofessional health team that includes a diverse group of members, whether that's physicians, specialists, nurses, psychologists, psychiatrists, or many other health professionals, depending on the consumer's need. So what's driving this demand for integration and kind of why now? I know that when I worked for a health plan many years ago, we started talking about integration. It's very important to have both the behavioral health and the medical side involved in working together when it comes to some of these clients who have not only complex needs, but also some special needs. So while I've heard about this for many years, it seems like all of a sudden there is a major increase in drive. So a lot of that comes down to consumer preferences, primarily convenience for the consumers. It is easier to talk to a team that understands what's going on than to go to each individual provider and have to explain again what's going on or coordinate between them. Also, the payers want an increase in value for themselves. And COVID, I believe, has also really launched us into the virtual primary care, and it's become more widely accepted. And we have realized what we can do, not only to increase the convenience of the consumer and increase the value of the provider, but also to bring this virtual reality into being when it comes to healthcare. Why is there a preference for integrated care? Studies have shown that consumer outcomes have shown to improve when there is a integrated care model. We also know that fee-for-service reimbursement for providers do not work well in an integrated care model because it does not allow for the maximum benefit of this model to be achieved. So we're seeing a lot of the fee-for-service being replaced with value-based reimbursement. And there needs to be a financial incentive that goes along with that value-based reimbursement. And it also needs to be flexible and customized according to what the consumer needs, also to what the local healthcare needs are as far as the individual culture, as well as the provider needs. So as we can see, you know, the integrated coordinated care, and then we have the consumer record level, and we'll talk a little bit about that in just a few minutes. So we're now integrating all of that together. It's not two separate medical records, it's all one. We're pulling value-based contracting in, where we have some flexibility for the models and the programs to be built towards the local area, as well as the local healthcare system, and then financially aligned with the outcomes. So that's kind of what we're seeing and why it's a preferred model. So with that, and really kind of looking at the implications here, I'm going to turn this over to my colleague, Kathy Gilbert, and she's going to review the Open Minds top 10 models of integration.
Hello, everybody, and nice to be here. Thank you, Margaret. And I want to talk about the different models of integration, and there's really no single model. And Margaret mentioned a couple models of health plans, but you may see even different models within the health plan, depending on the market and the size of the plan. So what are the things that they look at? They vary by market. It could be care coordination, it could be service delivery, it could be both, it could be any combination. Another piece that drives the model is how the information is shared between models. Is it a health system, for example, that may have all one medical record system that they use that also has a health plan? Or it could be how services are delivered. Is it a collaborative model that they have a closed referral system? Is it, you know, co-located? There are a variety of ways, or virtual. And then the financial incentives among the stakeholders that are involved in that model, and what the models impact by the decisions made on each of those first things. The models impact your service lines, and service lines are your physical health, your mental health, as well as, is it Medicare, is it Medicaid, is it commercial? So it'll drive your revenue, the margins, and is the model actually sustainable? And executives really need to look at their whole market. Margaret mentioned even the culture and the locality has an impact on what model will really fit with the population served. And then they have to make that decision on what the model is that will be most relevant and have the most impact to improve the care received by the consumers in that area. So Open Minds, we did kind of a look at all the different models that are out there. Margaret mentioned a couple as she was talking through, and we've identified 10 different models. Now, this may not be the only 10, it's continuing to evolve, but and we're going to talk about each of these models in a little more detail. There can be a combination of any of these. So the models include virtual care embedded with a health plan, vertical specialty health plans, and there are more of those specialty health plans out there. We'll talk about those, and different states are doing those a lot in the Medicaid space. Primary care services with tech-enabled specialty care. So it may be that the primary care physician has direct access to a behavioral health clinician virtually when that member is in the office. Virtual hospitals and telehospital. We'll talk about hospital at home. That's becoming a new way of receiving care. Children's coordinated care, and that's pending some regulations and revisions at CMS. Health plan, health system provision on the long-term care side. And then expansion of the retail health concepts with the Amazons and then Walgreens and Walmart and all these on-site clinics. That's having an impact. Health plan sponsored, tech-enabled in-home primary care. And there's more about that in the news every day. And then the health plan ACO health system risk alignment. That's been around a little bit longer with the ACOs, but it's definitely something that's still there. And then fully integrated health plan, health system models, kind of that pay-vider concept. So we talk about virtual care, which has really come into its own during the pandemic. Prior to the pandemic, telehealth services in the behavioral health world where I came from was about 1% of all the services provided. Now, virtual care, we're guessing it's going to level off around 40 to 50% of all of the behavioral health care provided, but it was up around 80, 90% during the pandemic. But the definition is the health plan contracts with an organization that has an app, could be on a smartphone, could be telephonic, that provides services in a completely virtual environment. You've heard of some of these organizations, Talkspace, Ginger, there's Lyra, there's many of them out there now and more every day. That's where you hear about venture capital dollars going into all this virtual health care. And they do wellness, teletherapy, e-counseling services. And there's a new headline, like I said, almost every day. These virtual delivery systems, virtual behavioral health provider networks, they have providers lined up with direct contracts with health plans. So the referral is very easy, whether it's in the primary care office or for the health plan. There's almost an instantaneous warm contact, direct transfer, even appointment scheduling with these for consumers directly from the health plan. So it raises the bar on performance as well as convenience. Because the other thing these virtual care providers have is data. Because they're on a digital platform, they're already their data is there. They can report on their outcomes and how quick they can access care. So that's a real implication, and it goes to more traditional providers. It's something they need to think about, of making sure they have that same level of data, because that's where the virtual providers on a virtual platform, it's right there.